Stent treatment or surgical closure for perforated duodenal ulcers, a prospective randomized study sponsored by SAGES. The authors have nothing to disclose. Background: perforated ulcer remains a serious condition with high morbidity and mortality. The population affected by peptic ulcer perforation has changed during history. Today, most of the patients show increasing age and comorbidity, often resulting in higher mortality. Since the late 1800s, the traditional treatment of perforated peptic ulcer is surgical closure. Patients with high surgical risks have been treated conservatively with nasogastric tube and suction, but patients treated conservatively have high mortality. Esophageal perforations and anastomotic leakages have been treated with endoscopically placed covered stents and drainage with good results. We have treated selected patients with a perforated duodenal ulcer with a partially covered stent with good outcome. The aim of this study was to investigate the safety and efficacy of a stent treatment for perforated duodenal ulcers compared with traditional surgical closure. Methods. This study was approved by the Regional Ethics Committee of Västra Götaland in Sweden. A multicenter randomized controlled trial was initiated. All patients presenting at the ER with abdominal pain, clinical signs of an upper GA perforation, and free air on a CT scan during December 2014 to August 2018 were approached for inclusion and randomized between surgical closure and stent treatment. Age, ASE score, operation time, complications, and hospital stay were recorded. Laparoscopy was performed in all patients to establish diagnosis. Surgical closure was performed using open or laparoscopic techniques according to the surgeon preference. For stent treatment, a perioperative gastroscopy was performed and a partially covered stent was placed through the scope. Abdominal lavage was performed in all patients and a drain was placed for leakage control. All patients receive antibiotics and intravenous PPIs. Stents were endoscopically removed after 2 to 3 weeks. Complications were recorded and classified according to Clavien-Dindo. Results. A total of 43 patients were included in the study. 15 patients were excluded. 11 had other perforations. 3 patients were excluded due to protocol violation and 1 patient withdrew the consent. 28 had a verified perforated duodenal ulcer. 15 were randomized to surgical closure and 13 to stent treatment. This is a summary of the results. Median age in the surgical group was 75 years versus 80 in the stent treatment group. There was no difference in morbidity or mortality between the groups. There was no difference between the groups regarding hospital stay. As you can see in the graph, ASE score show a tendency towards uneven distribution comparing the two groups. Operation time was significantly shorter in the stent group, 68 minutes versus 92 in the surgical closure group. As we can see here, in the surgical closure group, 6 patients had a complication Clavien-Dindo 2 to 5. 2 patients had postoperative non-specific fever and 1 patient had pneumonia. 1 patient presented leakage on postoperative day 1 and was treated with the stent placement during 22 days. The same patient developed an abdominal abscess needing percutaneous drainage. 2 patients needed postoperative ICU care due to renal and circulatory failure needing inotropic support. One of them also needed total parenteral nutrition due to a postoperative stenosis at the surgical closure site. The stenosis was not treated because of high age and comorbidity. In the stent group, 2 patients developed an abdominal abscess and were both treated with percutaneous drainage. One patient had signs of leakage after stent placement and was treated with a new stent with good outcome. 3 patients needed postoperative ICU care for inotropic support during 1 to 2 days. One patient developed multi-organ failure and died. This patient presented at the ER with a week-long history of abdominal pain in a clinically septic condition, postoperatively developing atrial fibrillation and cardiac failure. Conclusions. There was no difference in treatment outcome, while stent treatment seems to be a safe and effective alternative to surgical closure. Stent treatment seems to be an effective alternative to treat suture line leakage after surgical closure. A larger sample size would be necessary to show non-inferiority regarding stent treatment. Thank you for your attention.